Hello, I'm Antoni Chan, consultant rheumatologist from London, United Kingdom, reporting here at ACR 21 for the Room Now site. One of the interesting questions that we often ask in the context of spondyloarthritis is the radiographic progression. We divide the patients into either the non-radiographic axial spondyloarthritis group and the radiographic axial spondyloarthritis group, also known as ankylosing spondylitis. And one often asks what is the rate of progression from the non-radiographic arm to the radiographic arm. There's an interesting abstract, number 0907, presented here at ACR 21, where they looked at the radiographic progression in the non-radiographic group over a 6-year period. On average, they found that the rate of progression was about 10% every 2 years. In this study, where they had 79 patients, 10% of patients progress from a non-radiographic to radiographic, that is X-ray changes at 2 years, another 8.3% in the next 2 years after that, and then finally another 12.5% going at the 4 to 6 year mark. So I think this tells us that the continuum that happens with the radiographic progression from the non-radiographic form to the radiographic form. Equally, it's also important to understand in patients who don't progress and what are the characteristics of this patient, which will be certainly a research question for the future. And what are the factors that predict these progression? And that is covered from another interesting abstract, and this was 0897 at ACR 21, where they looked at the factors that cause the radiographic progression in axial spondyloarthritis. And what the study showed that the rate of progression was greatest between the ages of 30 to 39. And often these are times when these patients are diagnosed, and the delays to diagnosis could actually be adding to the fact that this radiographic progression is happening prior to the diagnosis being made. So in this group, in 30 to 39, other factors that are important is the presence of any baseline syndesmophytes or baseline demographic radiographic change. Baseline radiographic change predicts a quicker and accelerated phase of radiographic progression in the earlier phases or earlier ages compared to the 30 to 39 group. So if you had X-ray changes in these patients, they would kind of shift earlier in terms of their radiographic progression compared to the standard, which is the 30 to 39 group. I think both these abstracts tell us that we are looking at a heterogeneous group of patients here, and some are quicker progressors and some are slower, and some perhaps are non-progressors. So this would be an important research question for us to identify these patients, and then we'll be able to select the appropriate treatment to help reduce the rate of progression in axial spondyloarthritis. I'm Antoni Chan, reporting for Room Now here at ACR 21.